Good evening and welcome to blackdoctor.org. I'm your host tonight, Shamika Rhymes. Let me know in the chat where you are watching from. And remember, share this with your network because you never know who may need to see this. So, September is Sickle Cell Awareness Month. And in part one of our series, we're going to explore what it means to live with sickle cell disease, from managing pain to navigating school, work, and family life. We're also going to talk about the role of caregivers, the barriers patients face in healthcare, and the promising advances in treatment and more. And most importantly, we're going to hear directly from the experts and voices of lived experience about what true advocacy and support looks like. Let me introduce you to tonight's guest. We've got Dr. Eleanor Fleming. She is a CDC trained dental epidemiologist and board certified public health dentist with both domestic and global experience in public health. Hi, Dr. Fleming.
Hello, how are you?
I'm doing well. Thank you for joining us tonight.
Yeah, it's lovely to be here.
We've got Dr. Marjorie Deschwa Brewer. She is a senior physician, scientist, and medical director. Plus, she is a sickle cell patient herself. So she's bringing both the medical expertise and the lived experience to this conversation. Welcome.
Thank you, Shamika. Nice to be here.
Great to see you. And then we've got Elle Cole. She is the founder of Cleverly Changing, and she is a caregiver. So she's going to share the day-to-day realities and unique challenges of supporting a loved one with sickle cell. Welcome.
Thank you. It's a pleasure to be here.
So I am so excited to kick off this conversation. So, feel free to jump in wherever. And everyone in the chat, if you have a question, please drop it in the chat and we will get to those as we go throughout the evening. So I'm going to start with you, Dr. Fleming. What is sickle cell disease and how does it affect the body?
Sickle cell disease is a genetic disease, which I was doing some research this afternoon to refresh myself, and was shocked that I had forgotten that it is a global disease, right? Like I think that somehow being Black in the United States, I tend to think this as a condition that primarily affects Black people in this country, which it does. But once I started, going down the rabbit hole, I was shocked by, the global burden of disease, but also the absence of great scientific research about sickle cell anemia and the multiple ways that it can affect the body. And especially as a dentist, it was striking to me that the research is very shallow. And the majority of it is conducted in countries like Nigeria, countries like India, like places where the science is clearly moving forward, but there was very little in the United States. And so I named that because I realized that sickle cell anemia is one of those conditions that we often think of, and rightfully so, with one being a physician and going into the healthcare space, which again, totally makes sense given the nature of, a blood disease. But as we think about like the larger implications for health, I just want to name those gaps and encourage people, like as they are engaged with caregiving or supporting people who are living with this diagnosis, to remember oral health, mental health, and all the multiple dimensions of wellness that may be impacted.
Thank you. Dr. Marjorie, did you want to weigh in on what sickle cell disease is and how it affects the body?
Sure. Yeah, I just wanted to add, Dr. Fleming already gave some amazing information. I think, traditionally we think of sickle cell disease as a disease of the red blood cells. And for individuals who are in the audience, I want to, make sure that they understand that though genetically it is because of an amino acid change that affects the shape of the sickle cell disease, and then when under stress, predominantly oxidative stress in the body, which can appear externally as many different types of stressors that can ignite, stimulate the shift and the change. We know that the cell in itself goes from a nice, supple, soft, round disc shape that is very pliable to a cell that is more rigid and fragile, that looks like a sickle, like a moon shape, or this sickle, which is a farm tool that we used Back in the day, I think we still use it today, ergo, where it gets its name from. But over the years, that definition has evolved. So it goes beyond just the red blood cell. And with all the research that we are doing in sickle cell disease and the amazing physicians and scientists, I think the new terms that we like to say and use is that it's a disease of the red blood cell, the white blood cells, the platelet cells, and the endothelial cells. The fact that our body, is made up of all these cells, and the red blood cell can go everywhere and anywhere. It is amazing when you look at how this disease can develop and how it expresses itself, that there is no part of the body that is immune to what can happen, right, when a cell sickles. And when you think of the importance of what a blood cell does, it carries oxygen throughout the body. Its job is to carry those 4 important units of oxygen, which then feeds every level in our body. And something that's, a function that's so vital for existence, but we, simplify and take for granted that one small change can have such a vast effect on individuals. And then we also know that when that one individual within that family is sick, it also has ramifications that so many others can have. And to this day, when you have a bad sickle cell crisis, it can still take an individual's life away. And so the severity of this disease, including just having the trait, is not to be underestimated by any means. So I would just add that so that people can really get a sense for how expansive and how devastating this disease can still be to this day. And it is definitely a global disease, as Dr. Fleming has already indicated.
Well, to piggyback on that, can you explain a little bit about, or you or Dr. Fleming, about the genetics, meaning how it's passed down and why it seems to disproportionately affect the Black community? Well, obviously, globally.
Yeah. You want to start, Dr. Fleming? You want me to jump in and start off?
I'm going to defer to the physician on this one, because I feel like your explanation of genetics is going to be superior to mine.
No worries. My pleasure to start it off. So it is a recessive gene. So it is not a dominant gene, meaning you don't just get it from one parent. Like I like to say in the explanation, it takes 2 to tango. You have to get the genes from both parents in order to, as the individual, fully express it. When you talk about the percent or genetics, as we say, we always say it's 1 in 4 chance that you as an individual can get sickle cell disease if you have 2 parents that have the trait, or a parent that has a trait and the disease. And that is 1 in 4 of every single time that those parents have a child. And I think, historically, in many of the conversations we've had, there's always this misunderstanding at times when how this disease is passed on is explained. And you are confronted sometimes with families that are confused, and they're like, I had 4 kids and they told me it was 1 in 4. Why is it that 3 of my children have sickle cell disease? Which to me, then, when I hear that story, is devastating, because that means then the epidemiology or the genetics of it, how it's passed on, was not fully explained or clearly explained to the parents at the time. And then there are many cases where, because sometimes when you have the trait, you don't express symptoms that are normally associated. We have learned so much more about sickle cell trait, and that it has so many different levels of expression that to this day, many individuals don't know that they're carriers. They don't know that they have the trait. So we always suggest and recommend that individuals really look at their family tree, get genetic testing, and find out whether or not they have the trait, because then they can do the proper preparation, before they have a child. Now, as far as the question is, why is it predominantly in the African American population? And I'll just start that conversation. And please, ladies on the panel, if you want to add anything to it. Originally, sickle cell disease was a protective trait when it comes to countries that had malaria, very, very large cases of malaria. So, as you know, there was a reel recently of an individual, of a warrior, who posted and talked about the story as a superpower. This was originally something that was to be protective, but then when you get populations and different communities that cross, that meet, that then populate and have children, the gene itself and its expression will change and will shift. So it went out of these areas in which it was solely protective from malaria into areas that did not have malaria, and over generations and over years, that gene then changed its expression because of the environment and the stressors and the makeup of the individuals that had it. So we went from something that's supposed to be protective and helpful to now this disease that expresses itself and has some very, very significant ramifications, if I can use that type of a word, or just it really develops and can express itself and really do significant damage to the body. So I think on a very basic, simple level, those are the two things I would say about how and why it's expressed. But again, we know that no race, no background is immune to sickle cell disease. It does not have a color. It in itself is genetic. So it's about the science. It takes two to tango, two traits, and then you can have the full expression of the disease.
I'm glad you mentioned that. Go ahead. I'm sorry.
If I may, just from a public health perspective, to really emphasize the importance of being screened. And, it is a very simple blood test. Like, it's nothing that is like complicated or, overly cumbersome. It's basically you having a conversation with your physician and saying, I'd like to have this added to my blood test. So, just if there's one thing that people can take away, if you're not sure when you go for your annual physical, to ask so that you'll know for sure.
Yeah.
Okay. Elle, did you want to weigh in on this?
Sure. So I just kind of wanted to share that as someone with sickle cell trait, you most likely may not know that you have it. I am the youngest of five, and none of my other siblings have sickle cell trait. So I am the only child in my family that has sickle cell trait. So when I was dating, it wasn't something that was on my radar. When I got married, it wasn't a question that I asked. But when now knowing what I know, because I have a child with sickle cell disease, it is a question that we should be asking in our community. And sickle cell trait is not the same as sickle cell disease. And I think sometimes in our community, things are stigmatized and people get concerned about, oh, is it saying that I have a problem? No, it's not saying that you have a problem, but your genetics do matter because it can harm you or your offspring. And so as I've learned and researched, it's a question that I wish I had have asked. And so from that standpoint, I just kind of wanted to share that you can have it and not know, because neither me nor my husband, we met in college. We did not know that we were carriers of the sickle cell trait and what that meant for our future.
Thank you for sharing. Well, let's talk a little bit about the symptoms. I'm curious, Dr. Brewer, if you can talk a little bit about the symptoms, and then I want to hear from Elle about any symptoms that she noticed with her child.
Sure. So with sickle cell disease, there is a range of symptoms. There are a range of symptoms and how it can express itself. Now, they always, when you're in a conversation, when we talk about sickle cell disease, they always say that the hallmark of sickle cell disease is the pain crisis. Most individuals will present with some type of pain in any location of their body. Now, as a warrior myself, I tend to describe it as 4 different types of pain, which can show up in, my muscles, my bones, my organs, and anywhere. And the only, sometimes with my providers, I used to joke that the only place that I haven't had a crisis yet is in my earlobes. Literally, wherever a blood cell goes, you can have pain. So what we also know is that there are different types of pain. There are different levels and intensity of pain. There is acute pain, those that happen very sharply and acutely within the midst of an acute crisis that can then build and present itself for some people like a knife-like pain, for some people like a deep boring pain, for some people like a wave-like pulsatile pain. For me, that's the way it tends to present when it's an acute crisis. And then we also have a phase of it that is a chronic pain syndrome, which is more of the lasting pain after the damage is done, so to speak. So that, for instance, in your bone, if you have it, or even in some dental issues, because I've had crisis in my teeth and my gums also, which I have to say was one of the most unbearable crises that I've ever had in my entire life. But there's a level of pain that many individuals that have sickle cell disease then grow up with and live with for the rest of their lives. And even that in itself can change depending on environment, depending on the stress that they're under, depending on the activity that they're doing, depending on the location that they're at, that they're in. Other symptoms that we see when we see sickle cell disease, some individuals can get very dehydrated. Some individuals can present with yellowing of the eyes. When you're younger, some individuals have hand and eye issues that they might present with swelling of the hands and swelling of the feet. Some people would consider the increased ability to have an infection because our immune system tends to be weaker than most other individuals as part of the symptomatology that presents itself. So I, as a warrior, will get sicker. My flu is, larger than life at times. What some individuals get, it lasts a week. I'm out for literally a month. A fever is something that we look a lot as an indicator in young children, but it's the same in adults, so that with the fever can come the infection. It can land in different organs so that the complications there. So then you'll first have the symptom or the crisis in itself, right? And those symptoms I may present itself: fatigue, nausea. For some individuals, I separate fatigue and exhaustion because I feel like it's two different things. You might get tired, but individuals that have this disease process really experience it differently. Some of us have difficulties breathing because of the challenge in the oxygen, and it's palpable, so to speak. You can hear it at times when you are around individuals, the way it shifts in either the intensity of how they're breathing, the speed to which they're breathing, the sounds they make at times when they breathe. Many of us have trouble sleeping because the acute crisis keeps us up, and it's almost like you're walking on eggshells. Even a touch or the wind blowing against us, if it's nerve pain, because our nerves can also get damaged, that something so minor can then become a mountain, or something that we then have to cope with, deal with. And not to mention, at times our emotions can be completely all over the place and very shortened. We tend to keep to ourselves and be a little bit more shut down when we are within a crisis. But then when the acute pain gets very intense, you will hear the crying, you will hear the screaming, you will hear the moaning. It can get very, very uncomfortable because the symptoms themselves are like a hurricane and tornado. You really do feel like you're having an out-of-body experience. And the most challenging part is that there's nothing you can do to control it. There are tools to try to soothe what you're going through, but the complete, cessation of a crisis, and to be able to just do one quick thing just to stop it, does not exist for us as warriors. We have to ride that wave. So I'd say, as far as how it can present in an acute setting, and again, it's different for everyone. But some of the characteristics hold true in all individuals. It in itself can present in all those ways that I just shared, which is very, very different from the complications that may develop. And I will yield the floor so that others can also share what they've either seen, felt, because I will say, as a caregiver, I feel like sometimes my family feels the pain that I'm going through because they're there with me and they've been through so many crises. I can almost see it on their face. As I'm going through a wave, they're going through a wave. So it is not just the one individual that goes through it. I think everyone who loves and cares for that individual also goes through what they're going through when they have a crisis.
Mm-hmm. Elle, do you want to share, like, from your perspective as a caregiver, what you have seen from your loved one, like what symptoms, and do you experience what Dr. Marjorie was just talking about, like the empathy?
So I want to just share that sickle cell disease is very different from person to person.
Mm-hmm.
While pain crisis is the hallmark, it doesn't necessarily mean that everybody has pain crisis. They will have a pain crisis more likely than not, but it shows up very differently. So for my daughter, her complications and symptoms don't show up as pain crisis. So I like to tell people that sickle cell disease is more than pain, because that doesn't necessarily diminish our worry and our concern as a family. Because even though a person isn't in crisis, and screaming and having unbearable joint pain or significant pain, sickle cell can still be wreaking havoc on their body. And so in my daughter's case, it presents as extreme fatigue. So that means that it's difficult for her to go to school all day and stay up and do her homework. And because sickle cell disease is an invisible disease, it's also difficult for people to believe that you're experiencing complications when you're you may not look like you're sick. So that is a huge challenge. The stress, life is already, it has its stressors, but for a person with sickle cell disease, that stress can definitely affect them. And so it's even the weather. So right now we have a season change. So for my daughter, when the seasons start to change, she does get more tired, and she does have more trouble sleeping at night. And while that seems minor, it's really a major thing because it's every day. It's not a short time, and it's not something that you can control and turn off. The hardest part about sickle cell, from my perspective, is its unpredictable nature. It can wreak havoc out of nowhere, it can change your plans. And I actually have twins. So my daughter has a twin sister who doesn't have sickle cell disease. And I must be very honest with you all and say their lives are not the same. So, my daughter, who doesn't have sickle cell disease, she has sickle cell trait, she's able to go out and play with her friends and really have a full life without feeling the burdens or the barriers of having a chronic disease. And when you have a chronic illness, just having it and always having to be concerned about it, that can also cause you to have extreme fatigue because you get tired of dealing with this thing that you can't control. So I just wanted to put that in perspective for people, that it is disruptive. And as a person who's a caregiver, I will never say that I feel her pain because I can't walk in her shoes, but I can support her, I can empathize, and I can be there for her. And that's how I choose to show up. I try to give the gift of advocacy by speaking up for her and others because that's something that I can control, but I can't control or feel the pain that she's going through.
Thank you for sharing. Dr. Fleming, oral
Shamika, I
health
just
is
want to
on.
add one
Oh,
more
yeah,
thing before
absolutely.
Dr.
Go ahead.
Fleming jumps in.
I'm sorry.
There's
Go
a
ahead.
component, yeah, there's a component to this because we were talking about symptoms and what usually shows up and the like. And as Elle said, it shows up differently as I started and when I opened up, it shows up so differently in so many people. It is very what we call heterogeneous. There is
Mhm.
no typical presentation. I would say it's probably the most atypical disease that you can actually encounter. But what I always describe, I'll use the word disruption. It is a disease of interruption because what I find is that it can come on. What I find is that is a big struggle, and I'll speak from myself, is that it can come on very suddenly, and it really forces you in a way because I think as human beings we all want to just kind of enjoy our lives, have the best quality of life that we can, and kind of put our best foot forward and be the best humans that we like. And sickle cell disease, in a sense, is very sneaky in the way that it can come on so suddenly that it completely interrupts your plans, so to speak. It interrupts the flow that your life may be in. And when you experience that, you almost have to start all over again. It's almost like rebuilding yourself from scratch whenever it presents in however way that it presents. And that in itself is a component of this disease that is not often spoken of in detail when you get in the emergency rooms or you get in with your physicians, though we do talk about it in the community because it strikes you in a way and causes you to have to almost rebuild your life in a way that most individuals don't experience at the cadence, at the rate that we have to. And it's almost like you're always looking back when you're thinking, a week ago I was just doing this, or a couple of days ago I was just able to do this, and now all of a sudden I'm faced with this situation where I feel like, one, everything is out of my control, and two, I can't do a third, I mean even a quarter of what felt like it was just normal every day. And I almost have to, it's almost like relearning to walk when you have a crisis each and every time, and then searching for that normalcy, right? Searching for that, what was my life like, and how do I get back to that, at such a large percentage that we as ourselves, just thinking of ourselves, almost get lost in that process sometimes. And that's not often spoken of, but it's dealt with silently. And I think the community as a whole is really trying to do better in making sure that we put a voice to that, because I think that in itself, it's almost like, where do I belong socially for myself, and how do I then live to my best life, if every time I think I'm getting there, or getting closer to something, it is then taken away from me, and over and over again. So I don't want to just shed a little light on that component of what this disease does to everyone.
Thank you. And I wanted to, the next question, because you mentioned, Dr. Marjorie, about the teeth and gum pain. So I thought Dr. Fleming could go into that a little bit, because oral health sometimes isn't mentioned a lot when talking about this disease. So what are some dental complications or risks that people with sickle cell face, and why is dental care so important in their overall health journey?
So this is a fascinating question to me. And honestly, until this conversation came up, I can't say that I honestly thought about it. And so I went to the science to find out, like, what do we know and what do we not know? And as I started out, like, there are gaps in the literature, right? Like, if you look at, a lot of the systematic reviews, or, large studies looking at data, like, so many of these things are inconclusive about the relationship between sickle cell disease and oral health, which, to me is one of the best examples of, like, we put money into the research and the study of things that we think are important. And perhaps because sickle cell disease affects like 100,000 people in the United States, like, we don't see that as being important. But it's very telling to me that, they're not those very clear connections. I did find an interesting study that was done 2 decades ago at Howard University's College of Dentistry, and it was looking at its patient pool, which is largely people who are Black or African descent. And what they found was differences in the amount of decay that people with sickle cell disease had compared to those who didn't, like differences in the burden of periodontal disease or gum disease. And I'm naming these differences because how science looks at things and compute in communities is comparing those who have the condition versus a control. And because we know that oral health in general for most Americans and most people around the world, it's poor. It tells me that, this is a population where there should be extra concern about their oral health. And in listening to you, Dr. Marjorie, and listening to you, Elle, describe like the disruptions that happen in people's lives, like, I get it, right? If you're rebuilding your life or trying to figure out what your new normal is, that dental appointment every 6 months probably isn't going to make it to your radar. If you're in extreme pain, the degree to which you're going to floss and brush your teeth strikes me as being something that is probably not going to be on a priority. If you're experiencing dehydration, you're not thinking about how that dry mouth is creating the perfect environment for cavities to take place. And so I share all of that because, one, there are just gaps in knowledge, which are always very telling to me. And what I could find in terms of, the textbook way that, a dentist or oral health professional is taught to support a patient with a diagnosis of sickle cell disease, it was very limited. Like, speak to the physician. Like, I don't know what that I don't know what that really means in a healthcare system where medical and dental don't communicate, which means that then puts the burden on the patient to then do this extra work. So, if your listeners take nothing away from this aside from my call to be, screened and really to know your status, for those who are caregivers or for those who are the warriors, just to make sure that somehow you figure out how to best include managing, the health of your mouth, teeth, and gums with your overall health, because we know that, like, the bacteria that are in our mouths don't stay there, and they travel and they like to wreak havoc. And knowing that people who have sickle cell disease have challenges with their immune system, going into this, like, why would you up the ante and say, now I want my oral biome to wreak havoc in my body too? So, at a minimum, figuring out what brushing and flossing could look like, figuring out a diet that doesn't lead to, sugar sweetened beverages and more water, like healthy foods, like the things that one would normally do, but just being especially cognizant of that, and to the degree that having an oral health provider is a part of that health team, prioritizing that to the degree that one can, but knowing that a lot of what we can do at home with, fluoride rinses that you can get over the counter, toothpaste having fluoride in it, like, those are basic, steps that most people can take to try to give yourself, a fighting chance. But at the end of the day, when there's disruption in life, on top of, immune challenges, on top of, the sickle cells, like, a lot can go wrong. And again, those oral manifestations, like, aren't really named, which again, to me, is just very, very telling.
Thank you.
Shamika, I
Dr.
will add that they're definitely trying to connect the dots in a way when it comes to oral hygiene and dental care for individuals living with and individuals living with sickle cell disease in a way that they didn't do so intensely in the past. For instance, there's an inaugural event happening. I think they're calling it Patient Smiles. It is with a Baptist church coming up in Georgia, I believe. It's going to be the first of its kind, and it's led by dentists, which I think is absolutely fabulous. There are dentists that, specialize in the care of individuals living with sickle cell disease, because we do have certain manifestations. And like for myself, it turned out that I was getting oral ulcers, and they were actually always an indication that they were coming along with a crisis for a very significant chunk in my life, a time frame in my life, so that we were then treating it differently. And as you mentioned, with different fluoride rinses and the like. So there are definitely people who are paying more attention, doing more of the research, so that we as individuals can get the better care. There is definitely a more precise protocol before you go get dental work in now that is in place for individuals living with sickle cell disease, so that we, one, have less pain, two, have less of a chance of getting an infection, and also the follow-up and the like. But I definitely agree with you, Dr. Fleming. There are holes. There are probably holes and more research to be done in so many different layers and disciplines as it relates to the science in sickle cell disease. But there are many dentists that are taking up the fight, so to speak, and doing the work and leading the charge, so that we can be, you can tell so much by what happens in your mouth and in your gums and in your teeth. And having the right direction is so important. So we're thankful that there are individuals who are doing that work.
Absolutely. Let's see. This question is kind of for all of you, and whoever wants to answer, feel free to jump in. But what barriers make it harder to get a timely diagnosis and treatment? I feel like we've mentioned a few things just as we've been talking, but I wanted to kind of zero in on that. Dr. Marjorie, you look like you want to start.
And I saw Elle on mute. So when I let Elle, I mean, I did have one thing I was going to say, and then I'll let her go. I think one of the biggest challenges, so we fought really hard to get sickle cell disease as part of newborn screening. And it's supposed to be done in every state equally, and it is not. I think, we are still fighting to this day to make sure it is on everyone's lists, it is on radars, and that each state, because though it's a mandate, the states then can, individually decide what they're putting their funding to and how extensive each list is for newborn screening. So there are some states and hospitals that do a better job at it than others. So I would say that though we have come a long way when it comes to newborn screening, there are still many individuals to this day and who don't get diagnosed when they're first born. And, to me, that's like one of the biggest fallacies, only because we have made so many great advances in pediatrics and what the protocol needs to be once you're diagnosed and getting to the right hospital. And it is life and day for the quality of life and how well a young person and a child can grow and develop once they have that diagnosis, because information is power, education is power, and then you can actually at least go to the right people to get the information you need and the right treatment that you need and be around the right care team. So if I were to say anything, I am happy that there's newborn screening, because I and my brother, unfortunately, we did not benefit from newborn screening. So we were very late diagnoses. Even though we had symptoms that presented, I actually did not get officially diagnosed till I was a med student, which was challenging to grow up not knowing what was going on and what was wrong with you. But making sure that we keep fighting for newborn screening and that it is done universally, and that the attention is given to sickle cell disease and sickle cell trait in the way that it should. I think it's something that I always want to call out and bring attention to. And I'm gonna let Elle say what she was about to say.
So in the US, I would say the gap is follow up. So, yes, we do have newborn screening, but that works well when the person still lives in the same place, when they're able to accept that phone call, when they're able to know what's next. But here in the United States, every state works very differently. And so every state does it its own way, which is kind of problematic. We need something from the federal level saying this is how the follow up should be. And there needs to be a data registry so we truly know how many people have this disease. We are quoting statistics that need to be quantified and qualified, and that is not the case right now. So, what my concern is for the US is definitely the follow up, because just because a person finds out, oh, my. So basically, what happens, I'm going to share my experiences. When you're in the hospital and you have a child now, they do the newborn screening, which is in the heel prick when your child is born. However, they do a second test to confirm that. And that confirmation can happen like 3 months later. And so in my daughter's case, in the hospital, they said it looks like she has sickle cell disease. And that's because when a child is first born, they still have the fetal hemoglobin from their mom. And so it's fully developed, usually takes about 6 months. And that's when the fetal hemoglobin is no longer there as prevalent, they then start to have crisis. They may. And so what happens in the US is you're first tested, you may get that initial conversation, but then a follow up happens. So I'm in the state of Maryland, so I got a letter from my state. It said what type of sickle cell, because there are different types of sickle cell disease. And so that's something that we have to understand. When we've talked about sickle cell trait, that's the S trait. So a lot of people of color, 1 in 12, carry sickle cell trait, but there are other hemoglobinopathies that can mix with sickle cell disease. like SE, SD, SO, and so forth. And when someone procreates with someone that has the sickle cell trait who's a carrier, that also produces sickle cell disease. So now we refer to it as sickle cell disease and not just as sickle cell anemia as back in the day. And that wording has officially changed because of that. And so that's one of the things about the US that has to change. But on the global platform, many of those countries don't have newborn screening. So there are a lot of people who don't even have that initial conversation. And so it is our hope that newborn screening will be global all over the world so that people know. And so as a country, we definitely have to do better about telling people not just about sickle cell disease, because in that newborn screening, they also tell you that you have trait, but the follow up just in some places is non existent. So there needs to be a program that says, what does this mean? And what should I do next? And so many other genetic disorders, there is a protocol. And so, as a country, in our healthcare system, we definitely have to do better about telling the people what it means, what their concerns should be, what the risks are, what the symptoms, so that when they, at least for sickle cell trait, when they come of age and they decide to family plan, they should know, they should be able to make that informed decision.
And
Thank
if I
you for
may, kind
sharing.
of building upon the policy and public health implications around registries and timely follow up to connect people with care and accurate diagnoses, I was struck by the Sickle Cell Disease Association of America's statement against the Big Beautiful Bill and wanting to name the importance of cuts to programs like Medicaid and what they have in terms of actually making access to care complicated for a lot of people, and especially thinking about people living with sickle cell disease and what that means, to the complicated nature that Elle said of, federal and state, and every state has a different thing. Like, let's talk about Medicaid and what that means for people living with sickle cell disease. And I think the ways in which we're able to appreciate the very lived experiences of people with sickle cell disease and connecting that to all of the larger policies that not only affect them but others. I just want to emphasize that point, because I think that sometimes when we think about these public health policies or changes at institutions like CDC, where one would typically look to get guidance on newborn screenings and things like that, like when those institutions are reduced or cuts are made, like these are the issues that we're left to try to figure out and deal with. So just naming the importance of the big P policies that can affect the little p policies around screenings and connecting folks with care and things of that nature.
I think when the other layer, there are many layers, but another layer that I want to bring attention to is that it is so not just a responsibility of one physician and one team. When you think about sickle cell disease, it is a genetic disease that the individuals will live with for the rest of their lives, right? For the duration. And it manifests itself in so many different ways. It affects every system within our body. So as an individual, you are at times seen by 5 different specialists, because you have complications in 5 different parts of your body. Though you see the internist, right, who is supposed to be the gatekeeper at the beginning, you have your pediatrician, or you have the, OB-GYN team that, helps with the birth and all that. It is a disease that can be picked up by so many different individuals that are the part of your medical team, that I almost feel, that we do our community a disservice when the assumption is made, or that, oh, someone missed it. It should have been done when they were younger, or when they were little, or someone should have seen it. And it is the responsibility through the lifespan, and it is never too late to give the right care and help an individual live their life in the best way possible and get the proper treatment that they deserve. So I would say on one end, it is the responsibility of any provider that crosses that individual to have kind of just the basic knowledge of what sickle cell disease is. And we let them get away. They've gotten away with it for so many years. I was just in a heated conversation about a week ago, and we were talking about how providers should be doing better. Is the responsibility on a university, hospital, or the community hospital, or the specialist in this particular area? The reality is it's on all of them. It's on our providers to do a better job in just recognizing symptomatology, and when a person presents with certain problems or issues or complaints, that they should be taken at face value. Which leads me to my next point, is that we need to just believe the patient when they come in with what they're saying and give them the immediate care. When an individual has a crisis, it is supposed to be triaged at one of the highest levels so that they get immediate care, because I think individuals who are part of that community have seen how quickly an individual can deteriorate, and what starts out as a quote unquote simple crisis, because no crisis is simple, but what starts at something that feels like it should be treatable, right? Recognized, and if the person is plugged in, they should be able to get the proper care, all of a sudden unravels into something that is unmanageable, and the conversation changes within 12 hours, to something that we don't even want to have to talk about, which could have been avoided. So on the other end, when we talk about what is missing and what is needed, when you talk about providing the right care and providing the right diagnosis and seeing the right care given across the lifespan, it is really taking our patients at their word and listening to them and providing the care for them immediately, because it's their life that we're talking about. And it's their life that, if not cared for immediately, can become a completely different story that no one has to, should have to have that conversation or suffer to that extent. So I think the healthcare system on so many levels should be able to do better, and our policies should do better for our patients. And that stigma that is attached to it is unfortunately a very, very big burden. But I think as a community, we are trying to change that dialogue, change that conversation, and change the onus that the patient feels like they have to carry it all by themselves, because they shouldn't have to feel that on top of everything that they're already going through with this disease process.
It was interesting listening to you, Dr. Marjorie, and I was waiting for you to say, stigma. And when you did, it's like, I don't understand like why we as, a Black community, a human community, whatever, that we allow people to, bear the burdens of diseases that are not their fault, they didn't cause it, like they didn't make it. And to think about, healthcare providers, including dentists, including, others who, have some component of health in their work, aren't able to really hear, believe, and trust someone. Because I'm thinking, if a patient comes and they're telling me that they're in pain all day, like, am I going to understand and connect that to like, oh, wow, like, I wonder if they have, sickle cell disease or what's going on? Am I going to take the time to investigate and to listen? Or am I going to, not to be shady, like, shrug my shoulders and be like, okay, but tell me, like, why did you come in today? And, I think that you have given us, as healthcare professionals, like the great moment to pause and reflect and to think about, when that patient comes, are we going to listen? Are we going to be present with what they're going to say? Or do we just shrug it off and get to like the rest of the appointment and basically leave that person voiceless and struggling for, the care and support that they need? So I just wanted to echo that, because it just felt very much like insightful to me to just put a bookmark and flag it for people if that wasn't a light bulb moment for them.
Well, thank you for that. It's interesting, because whenever I that's one, so important I think it's so important that, one, this conversation is being had. So thank you for just inviting me to the table. But another thing that I always share is when I help do trainings for doctors who are, up and coming, or doctors in training, when we are kind of in that environment in the ED, or we have that waiting room that is full of patients, and we're just kind of on automatic mode and just trying to get through to the next, as a provider who's also a patient, I look at it from a different lens. And I always try to tell them, one, I need you to, before you go into the next room, I need you to, one, take a breath for the patient you just finished, and hopefully you gave them everything that they needed. Take a breath for yourself so that you can level set. And then take a breath so that you go into the room, so that when you are approaching that individual, you're not thinking of them with whatever you heard, from the last patient or the week before, or whatever. You really try to go in with a very open mind, a very open heart, and all the knowledge and training that you have, in order to elevate their voice, but really connect to what they're telling you in that moment, in that time. I've unfortunately been on the receiving end of individuals who, even as a physician, oh, we saw that this worked for the two patients that were, here 2 months ago. So we think that you're not giving yourself the right treatment. We're going to switch it up. I'm just like, yeah, but those were those patients, and and again, it was in the hopes of getting me better, getting the process going, moving, being able to move to the next person. But in that moment in time, they were not just taking the moment to pause, listen to what I was trying to communicate, and really reassess the situation, what was in front of them. So I'm happy that I'm able to be part of any conversation that really helps our fellow providers and anyone that's within the healthcare team, because it only takes one person to kind of lead things in the right direction, right? And then they can make magic happen. And a lot of times we know it's the nurse. A lot of times it might be, the intern. It might be the physician assistant. It's not always the physician, because they do work as a team. But when that moment is just taken, and you can really appreciate, having that empathy and compassion is one thing, but really just actively listening to what that person is telling you in that moment, it can really change the face of what you provide for them, and how then the rest of that day, that week, that month goes for them, and it could be pivotal. So I hope that everyone takes a moment to take that breath and realize that they can bring so much to the table if they really just take the person at face value and actively listen in that moment.
Goodness, the hour has almost gone by so fast. This conversation has been so good. I do want to get your final thoughts for what we can leave the audience with, whether it is, something about how they can get involved in advocacy. What are some resources, organizations? How can they help, even from a caregiver standpoint? What's one thing that you want them to take away from this conversation? Or maybe it's something we didn't get to mention. And I'm just going to go round robin. Elle, I'll start with you.
Sure. If it's okay, I'd like to share three quick things. First is, a lot of people with sickle cell disease need blood transfusions. So if you can, give blood. The second thing is, there are organizations all across the country who need volunteers. They are understaffed, but they have great big passion, and they want to do a lot of work. So volunteer at the organization closest to you. So you can go on um, the SCDAA, which is the Sickle Cell Disease Association of America's site, which is sicklecelldisease.org. Go on their website. There are organizations that are listed. Find one near you and help them out. The third thing is, I work for a sickle cell organization, and we didn't talk about mental health, but mental health is huge dealing with a chronic illness. There are a lot of resources available for our community when it comes to mental health. And one of those initiatives that I have spearheaded with Dr. Marjorie, and also a warrior named Heather, is I Believe in Therapy. And that is, there is a link on the sickle cell disease association's website, which is sicklecelldisease.org, that will give you resources of where mental health access is available for warriors. And so the organization that I work for is Cayenne Wellness Center in California. They will pay for you to get counseling. So that means the cost isn't given to you. And I'm sharing that because there are organizations that will get grants to help you manage this, and you want to be taking advantage of those resources. So there is respite care. So many organizations have resources, but we as a community must tell each other about it. I live in Prince George's County, Maryland. There is something called the PATHS program. So pgcpaths.org is a website that you can go to, and they offer vouchers for medical, getting to and from your medical appointments. So if you are in Prince George's County, go to that website, find out what resources you need, like food vouchers. Take advantage of those resources. So that's what I wanted to share, and I'll pass the mic on to the
Yeah.
next person.
Thank you. That's great resources. So thank you for sharing that. Dr. Marjorie.
Okay, so Elle said one of the things I was going to say, which was mental health and wellness. I'm love working with her, love working on that initiative. I always tell our community that going to the hospital in itself is to get you through the acute process, right? The Band-Aid, the hospital is really like the Band-Aid to make sure that we have checked the boxes when it comes to any immediate urgency that may happen to the individual. But I always like to remind individuals that the real healing, even my colleagues, the real healing happens when that individual has left the hospital. You know, we come in as individuals who have almost like felt like we've lost any connection we have to ourselves and are in need of some, help and support to just make it to that next breath without feeling like our lives are going to disappear in front of us. But the partnership that we have with our teams in order to really do the wellness care that happens beyond the four walls of that hospital are so important. And I think everyone within the care team has a role to play when it comes to educating, helping, and supporting individuals living with sickle cell disease. We are not born patients. So the expectation that we should know all this and all the changes as they happen to us is an unfair burden, and that being able to provide that assistance from whichever vantage point you are coming from, meaning the individuals that are that community that set themselves up around us, we are very altruistic. We are the individuals that will try not to ask for help because we do feel like we are burdens. So being able to tear those walls down and really extend a hand out to individuals and provide any assistance possible, I think is so important. And nurturing that mental health and wellness is the most important thing, I think, if we can teach our individuals that. To my fellow warriors, I would say that you are not alone. You are not alone. You're not alone. You're not alone. And individuals, if you're wondering what you can do for an individual with sickle cell disease, a text sometimes, just a message, could change the face of whatever that individual is going through. So don't be afraid to reach out and to ask what you can do, because sometimes just a word of support is what we need as warriors fighting through it, because it is a constant battle. But any piece of sunlight that someone can give us, we are more than willing to take. We may not want to ask, but we are more than willing to receive. So thank you for providing this format so that we can let individuals know that we are in this together and they are not alone.
Yeah, thank you for sharing that, because I've seen some people in the comments, and they, and people watching that may not be in the comments probably need to hear that. So thank you. Dr. Fleming, how about you? Anything you want to leave everyone with?
Yeah, and this is a bit random, but totally related. So I continue to be struck that, one of the many great contributions that the Black Panther Party gave to Black communities and to this country is sickle cell screenings. And I say this and name this as, an important contribution, because if we think about, what they were able to do in raising awareness about this disease and, doing, boots on the ground work at a community level, it makes me wonder now in 2025, like, where is that same energy? And I guess I will offer kind of the call to action to the churches, the mosques, the sororities, the fraternities, the professional organizations. Trust and believe. I'm going to go back to the National Dental Association and find out, where sickle cell disease should be on the annual conference or in a webinar. But we have to do more. And I think this history of the screening starting on the streets with the Black Panther Party should tell us that we have the capability to do a lot to support each other who are living with disease, to champion caregivers, but also, as we talked about, those big systems level things that need to happen in healthcare systems, in policy arenas, to be able to do that work too. So I just encourage us to remember that we come from an amazing ancestors, and thinking about what they did so many decades ago. How can we do more in the decades to come to better support, members of our community, but also, the global community living with this disease and condition as well.
Thank you, Dr. Fleming. I think that's a great call to action. I want to thank all three of you for coming and spending the evening with us and talking about this such important topic. And for more information about everything we talked about, sickle cell disease, sickle cell trait, you can head over to blackdoctor.org. There's a lot of articles and resources there. Make sure you check out all of the websites that we brought up today. And these are some amazing resources as well. Again, thank you for joining us. Thank you to all of you in the chat for watching. And stay tuned for part 2 of this series. That'll be on September 18th at 7 o'clock right here on blackdoctor.org. I hope you all have a wonderful evening.